Well, each Thursday we have the opportunity to join one of the doctors with Kaiser Permanente on the set here, and with us today is Dr. Eileen Seibert, and we're going to be talking about a somewhat sensitive but a very important topic today, and that is going to be constipation. And we talked just a little bit, thanks for joining us on the program, first of all. That's always a tough subject no matter what age or no matter who you're talking to. I have a 2-year-old, or if you're 80, it's still a very, very sensitive subject. Tell us a little bit about what is constipation, first of all.
I think everybody, at least at some time in their life, has experienced it. It's a bigger issue in the elderly population, especially because they take more medications that can cause constipation, and because it's more considered, they are more attuned to their bodies because of their activities in a daily life revolve around the daily living skills, you know, and then so it's a very big issue for them. Constipation is basically the inability to have a bowel movement when you want to have one, or that is very hard or very difficult in passing. And it is a big issue. I had a large geriatric practice before I became with Kaiser, and I dealt with this every day with patients, and a lot of it is medications, a lot of it is lifestyle. Activity decreases, water intake decreases, so there's a lot of issues.
As we get older, our metabolism slows down, so is that a big issue as well?
Yeah, well, one of the things is that people, when you're younger, you exercise more, people go to the gym, people tend to be more hydrated. As people get more elderly, they have difficulty in getting to the bathroom as quickly because of arthritis, or they need walkers or canes or whatever. And so they tend to kind of restrict their fluid intake. And when they restrict their fluid intake like that, they really have a greater risk of becoming constipated. Then they're taking pain medications, narcotic pain medicines, some blood pressure medicines. They can make them very constipated. And so it can become a very spiraling problem. You don't take water in, you don't go to the bathroom as often, you know, and it just kind of spirals down to a more difficult issue. It can get to the point where I've had men come in and they cannot urinate. One of the big issues, if you cannot urinate as a man, is to determine if they're actually constipated, because it can actually impact other areas of your body.
And a lot of times they don't want to drink too much water because they might be going to a function or going somewhere and they don't want to have to get up and go to the restroom.
Exactly. And if you have a gentleman with prostate problems, they have to go more frequently, and so these things are very compounding, and you can see how they can really impact. And then of course activity is very important, walking, exercising. Leisure World has Laguna Woods, I apologize. Laguna Woods has a beautiful exercise facility, golf courses and all these things, and people take advantage of them, but as they get older they tend to back off on those things, and then it becomes more of an issue.
What majority of the population is suffering from this ailment? Would you say mostly female or male?
I would say it's across the board.
Really?
I work in an urgent care setting, and I would say people come into the urgent care and the emergency rooms for this, because it gets, and I have had people come in and say they haven't had a bowel movement in 6 days. And they're very uncomfortable. They'll get to the point where they're nauseated and they can't eat. And that makes it even all worse.
And it's one of those ailments too that they almost wait too long, where if you have a cut or you broke your arm, you're more you're going to go and get it fixed right away. Where if you have constipation, people will be more embarrassed, or they just don't want to deal with it, and they'll just wait too long before they make that appointment.
Exactly. And they go to the pharmacy and they try to figure out what to do. And the problem is some people will get addicted to laxatives because they use a laxative that's very effective, a stimulant laxative. They use it, but then their body gets so used to having something stimulate them to go to the bathroom that they can't do it any other way. And that's called basically rebound constipation. And that's another problem. It's medication induced. Really
and the toxins that start to build up in your body, they break down, what parts of the body, what happens when constipation gets to the point that those toxins are really affecting them?
Well, it's not really toxins, it's more of a it's really not a toxin issue. It's really because your kidneys and your liver are responsible for detoxifying things. So basically it's a reservoir. Things sit there. The problem is that you become bloated, uncomfortable, you can get a headache, Basically, you just don't feel well.
Right.
And I think everyone who's ever traveled has experienced this at one time or another, because changing disruptions in your life, somebody in the hospital, not drinking enough fluid because you're on an airplane, you're traveling a lot and you don't want to stop.
Right.
Those types of things create these disruptions in your daily life, and that's what can create this. And it's just not pleasant for people, but it can be, like I said, it can be very serious.
What kind of treatments are out there for people?
Well, we try to get people to, I always encourage everyone to drink lots of water, to get lots of, exercise. And that's not running to the gym, that's taking a 15-minute walk. To eat a lot of fiber. In your diet, the best thing to do is take fiber in your diet, which is a variety of fruits and vegetables. That's the best thing you can do.
Yeah.
The next best thing is to take fiber as a supplement, and that's where Metamucil, Citruscil, and those types of products come in. And they work very well, but you have to take them every day. They're not a fix for, today I'm going to take a bunch of fiber and tomorrow I'm not.
Yeah.
And the other important reason for all of this is because diverticulitis occurs in the elderly, and that can be life-threatening. Diverticulitis can actually be like appendicitis, and people can die from it. And it's because of years of having such hard stools that you actually get little outpouchings in the colon. This is a very serious thing with elderly people. And the other thing is then finally using something like Miralax or something that's a non-stimulant laxative that will help you try to go. But increasing your water and your exercise and fruits and fibers are the three.
What does coffee do? It seems like people talk about coffee being kind of that.
It does work.
It
when
does.
I was in the intensive care unit, they used to give people who were intubated, they put coffee in their feeding tubes to try to get them to have a bowel movement.
So
in the old days, I'm showing my age now.
It does work then a little bit.
It does work a little bit.
Okay.
It's really funny. But you're
Tell
right.
us a little bit about your background. It was very interesting that we talked briefly. You're actually from Yale University, and you've worked your way all the way to California.
Yeah, I actually have a BS in pharmacy and a doctorate's in pharmacy. And I worked at Long's here in Laguna Woods on El Toro for several years. And that was before I got licensed as a physician, and then I became a physician. And I worked at Yale as a professor of pharmacology before I came out here.
Wow.
And now I've been working with Kaiser for the last 5 years.
Great.
And I work in their urgent care.
Sounds very good. That's Kaiser Permanente, and that's Dr. Eileen Seibert. Give them a call at 932-2052 if you have any questions or would like to possibly have some of these ailments taken care of. It sounds like it's a very important issue, obviously, and it affects many people. So thanks so much for joining us today. It's a very important subject.
Thank you very much.
That's Dr. Eileen Seibert. She's with Kaiser Permanente. Give them a call at 932-2052. We'll be right back with Peggy Blizzard and the Laguna Woods Globe right after these messages.
Kaiser Permanente. Thrive